Well, from the minute we wake up in the morning until we go to bed at night, we're using our hands. So what happens if we can't use them, or if using them is just too painful? It can make everyday tasks so much more difficult. Joining us this morning, she can help alleviate the pain and get us back to doing what we love to do. Dr. Madeline Lyons is here. She's a hand surgeon at Arizona Sports Medicine Center. Welcome to Sonoran Living.
Thank you.
Yeah, thank you. So first of all, what is Arizona Sports Medicine Center? What do you do there?
Yeah, it's a group of orthopedic surgeons and sports medicine doctors who take care of, a whole range of conditions from hand to foot and ankle to knee and shoulder problems. And we see all kinds of patients, professional athletes, weekend warriors, kids, adults, all kinds of things.
And how long has the center been around?
20 years.
Wow, long time, long time. So it makes me wonder, okay, if I have a hand issue and I'm not an athlete, maybe a little weekend warrior, but not an athlete, can we still come?
Of course, yep. I see all kinds of patients, and my big, priority is helping people figure out what's wrong with their hands and what's preventing them from doing the things that they want to do and how to get back to doing those things.
Yeah, and you just don't realize how much you use them every day and for everything, and all of a sudden when you can, it's really, really difficult. Let's talk about some of the most common reasons why people come in to see you.
Sure.
What are they?
So I see a lot of chronic problems like carpal tunnel syndrome and trigger finger or arthritis of the hands or wrist. I also see hand and wrist fractures, things like falls or, pickleball injuries, and then some overuse sports injuries as well.
So you can range from like the everyday kind of pain, and I'm pointing because I have pain right here and I want you to look at it after this, from that kind of chronic everyday ongoing pain to an actual injury.
Yep.
Do you have to be referred to you in order then after an injury to come in and see you?
Not usually. You can just call our office and get scheduled if you have any concerns, fell on your wrist and it's still hurting the next day or have swelling, we can come in, take an x-ray, see what's going on and figure out what the next steps are.
Yeah, it's all about a treatment plan too after that, and especially when it comes to types of chronic pain. They don't always need surgery, but that is what you specialize in, is that right?
Exactly, but I treat things from the beginning all the way through surgery if that's what's needed. So for things like thumb arthritis, there's lots of options like therapy, injections, medications, a lot of things we can try before jumping to surgery.
Yeah, and you just don't realize until all of a sudden you're trying to open something, you're like, ooh, wow, that's not good. And injuries are absolutely no fun. When you have patients who, our hands are everything, right? And they come in and there's this level of, fear. I'm sure, I know I have some like, is this going to keep getting worse? And how do you take that approach as a physician? Because that is something that, everybody handles it differently as well.
Yeah, I take that part of my job very seriously, and I think, I sit across from my patients and I ask them, what is it that this is preventing you from doing? What do you want to be able to do? And what is this interfering with? And how can we get you back to doing things that you want to do?
Yeah, because that's the ultimate goal, right? Do you have any suggestions? Is there anything that we can be doing to prevent any types of these injuries, especially the common ones?
Yeah, a lot of these overuse things kind of just happen with the things that we like to do. But if you are noticing that you're having more pain doing something, then it's always good to evaluate if there's a different way, different ergonomics or something that you can do to prevent that issue from getting worse. Whether that's adjusting your golf swing or using a different computer or mouse, all those things can be helpful.
Or even some sort of brace or something like that could be even helpful. And I'm guessing it's just like, just don't wait, right? Because it just gets worse over time.
It can, and there's a lot of things we can do to prevent things from getting worse and to just help you have less pain, even if it's a mild discomfort.
Excellent information. I love it. Thank you so much, Dr. Lyons, for joining us today. Really good information. Don't live with it. You don't have to. Arizona Sports Medicine Center is located near the Loop 101 in Villa de Ventura. You can reach them by calling 480-558-3744, or you can visit the website. It's asmcmd.com.